My name is Melanie, and I will be explaining the program and intervention. So, starting off with the intervention, we really focused on this Los Angeles Regional Food Bank. This organization serves a major source of food assistance just across all of Los Angeles County, partnering with over 600 community organizations, schools, and churches. So, each month, this food bank provides nutritious food to more than 800,000 residents who experience food insecurity or have low income, limited income, and then just challenges accessing healthy food options. So, our needs assessment showed that many families struggle with consistent access to nutrition food because of that financial instability, and then just the rising costs of living. Groceries have gotten up too. So these barriers really make nonprofit organizations like food banks very essential in providing that support. So we identified a clear need for reliable food distribution services, especially for vulnerable populations who depend on these programs to meet their nutritional needs. So, overall, the food bank plays a key role in reducing hunger and supporting community well being, which is why evaluating this program process is so important. And this is going to be our logic model. It focuses on the Los Angeles Regional Food Bank. It shows the key inputs the program uses, the activities it provides, the immediate outputs of those activities, and then the short and long term outcomes we expect to see in the community. This model really guided our process evaluation by helping us stay focused on how this program works and what it aims to accomplish. Our data collection method was mixed method research design. This is taking qualitative as well as quantitative data to try and look at the program as a whole to see where there might be gaps that need to be fixed or adjusted so that we are serving people the best we can. Quantitative data will be retrieved from records that are kept based off of surveys from clients. The data will be collected from people using the food bank to either receive food or a resource. And the data will seek to find the number of households served, number of pounds of food distributed, and the frequency of the disbursement per family. So, how often they used it, was it needed weekly or monthly, just based off of the family and their need for additional resources or food. Mentioned, we really used a mixed method research design. So our qualitative data will be collected through interviews, focus groups, and through observation by staff and volunteers who are working with the clients served. The data will be collected from people using the food bank to receive either food or resources, and the data will seek to find the areas of service that need to be improved, as well as provide feedback on how to improve the program to best provide for the clients.
Hi, my name is Kanashe. Now let's discuss how we will analyze the data. So once the data is collected, we will be using a mixed method analysis to combine the numerical data with the participant and staff perspectives, providing a complete understanding of how well the program functions in real world practices. So the quantitative data from like the distribution logs, intake forms, this will be analyzed using descriptive statistics. This includes like frequencies, means, percentages, and this is going to show us patterns of participation, service reach, and food security levels. For example, an analysis will look at how many households are served each month, how often do they return, and whether the services access differs by zip code or age or language group. And so when you combine that with qualitative data, like open-ended survey questions and staff interviews, which will be analyzed using a thematic analysis, which means reviewing all of the responses, identifying repeated ideas or words, and grouping them into these themes and such as like access barriers, respect and dignity, or program improvement. So when you combine that quantitative and that qualitative data and you analyze that, it will really give um, and explain how the participants are experiencing the program and whether the services feel high quality and culturally responsive. The statistics will help us to determine whether the food bank is effectively reaching its targeted community across the Los Angeles County. And this will really give us that well-rounded perspective on whether the LA Food Bank is reaching its targeted goals. Thank you.
Hi, my name is Sapphire, and I will be talking about data collection methods and sample. So for the sampling approach that we decided would fit best would be convenient sampling. We found this to work best as we are researching from the Los Angeles Regional Food Bank, and we are focusing on the Los Angeles County. So because we are doing that specific area, we thought convenient sampling would fit best. As far as our target population, it will be families with children under 17 years of age and in need of resources such as food, financial assistance, and etc. If the family does not have any children under the age of 17 years, then they will not qualify, and that is the only exclusion criteria that we do have. As far as consent, everything will be voluntary, and informed consent must be given prior to anything happening, any of the research, any of the information being shared, anything. Consent will have to be followed. We also will let them know that with the consent, if they want to stop being involved at any time, that is also totally okay. When informed consent is given, the research objective, confidentiality, duration of the research, and the client's right to withdraw will also be noted at that time. As far as the process, we first will have informed consent, both written and verbal. The second thing will be the survey completion. So the families that want to be involved in the research will have to connect to VPN as well as sign into an authenticator just to ensure all safety measures are being followed, because we want to keep all of the information protected as much as possible. The third thing will be that they will complete a survey every month, and that survey will be sent through the email. Again, they have to sign into the VPN as well as the authenticator. As far as the researchers' ethical obligations, researchers will not share any of the information regarding the participants, as well as respect when they wish to no longer participate. They must maintain confidentiality and adhere to the standards that the Los Angeles Food Bank requires, as well as standards of keeping all of the information safe. It's also important that all families are provided equal support, regardless of their participation or not, beliefs, apparent status, or any other factors. This is mainly because if a participant is involved in the research, we don't want them to get extras and have others feel left out. We want to be fair and consistent and ensure that we are supporting all families, whether they are participating or not, to the best of our abilities, and ensuring that we are meeting their needs.
Using a community-based participatory research approach will allow for the examination of food insecurity and nutrition, creating partnerships through all stages of the research process is very beneficial. That it gives a very full view of what the client's needs are and how to assist them the best way that the food bank can. Partner organizations could inform the Los Angeles Regional Food Bank their evaluation plan, including evaluation tools, assisting with data collection and sharing results. Working alongside community organizations can be helpful in interpreting findings and presenting results in an understandable way. The community-based participatory research approach prioritizes collaboration between organizations and community members. The organizations we identified that would be the most beneficial to the Los Angeles Regional Food Bank are LAUSD, Los Angeles Unified School District. This would allow for the food bank to understand how effective services are in assisting children with meals, snacks, and resources. This partnership could identify gaps in nutrition and access. The next organization we identified is called Community Coalition in South Los Angeles. This organization works to change social and economic conditions by empowering residents to influence their own policy change in their communities. This partnership could look to address racial inequalities that contribute to food insecurities for the food bank's clients. The next organization we identified is the Department of Public Health. The availability of county level health and nutrition data would serve to provide information on the clients that are being served, which could be helpful in identifying further nutrition needs.
So for our faith strategy, we really focused on compassion, fairness, and integrity. We view evaluation as an act of service, not as criticism. So this means that we approach clients and community partners with empathy, respect, making sure that the people who are being served and who are helping feel seen and valued throughout the process. Faith also helps just guide how we handle data ethically. We want to report findings honestly, protect confidentiality, and make recommendations that truly benefit the community. This aligns closely with the NASW Code of Ethics, which emphasizes just social justice, service, and dignity for every person. Overall, integrating faith just reminds us that the purpose of evaluation is to uplift these communities and support the meaningful long-term change.